Good morning, everyone. I am Patricia Turner. I'm the Executive Director and CEO of the American College of Surgeons, and it's really a pleasure to welcome all of you here this morning. Thank you for joining us as we spend a few minutes talking about the power of quality and something that has been part of the fabric of the American College of Surgeons for its 110-year history. All of you, representing some 28 partner hospitals in this community, are demonstrating your extraordinary commitment to the best possible patient care, and we appreciate you. We are thrilled to partner with you. We are thrilled to work with you to figure out how we can support you, how we can support your hospital systems, how we can support your surgeons, how we can support your patients as part of the fabric of the quality improvement programs of the American College of Surgeons and your commitment to quality improvement at your own institutions. So what we know is that current strategies are uneven, and that some of the processes are not necessarily as evidence-based as we would like them to be. We all know that volume does not equal quality. We all know that databases that are perhaps taken from a non-clinically rigorous way of capturing those data are not as demonstrative as they might be. And so taking claims data or taking other data are not as effective as what we know to be the best possible way to craft interventions. So we want to continue to drive the conversation. We want to continue to partner with each of you. And we're thrilled that you're here this morning and want to be our partners in this quality improvement initiative. So I'd like to introduce Dr. Clifford Coe, who is the architect of our quality improvement programs.
Thanks. Thank you, Dr. Turner, and welcome everybody. It's really a pleasure to see you all, and thank you for coming and spending some time with us this morning. My name's Clifford Coe. I'm the Director of the Division of Research and Optimal Patient Care at the College of Surgeons. I've been at the college for almost 20 years. I thought I was only going to be there for like 3 months, and then it turned out to be 20 years. But it is really terrific to work at the college because we get to work with hospitals like you and really kind of demonstrating how quality can be achieved. I think that as we all know now, that there's a number of national quality initiatives that we are having to follow, and it is just not cutting it. It is not getting us to where we want to go in terms of the quality that we want with the metrics that we're having to do. I mean, I am in California at our hospital, does 351 different metrics, and as I'm sure you all do, and it's not easy to do, and I'm not sure our frontline surgeons and the people taking care of the frontline surgical patients believe that it's really helping them all that much. And so when we're trying to do something, it would be worthwhile because we are putting a lot of resources into it. We spend a lot of money. We put a lot of people onto it. We spend a lot of time. We get energy and enthusiasm trying to work on these things. But if it's not getting us to where we want to go and not getting our patients to where we think they should go and where they want to go, there's a problem there. I think that what we're trying to now do is to say that, all right, we've been working in the background for decades, for 2 or 3 decades. Our trauma program has been verifying places for a number of decades. So we know that a level 1 trauma center meets standards. They use data. They're verified that they attain those standards. Same thing with our breast program and the bariatric program and the Commission on Cancer program and so on and so on and so on. Some of our newer programs are geriatric. That they have 3 main components that all of you are doing. They adhere to the standards, and these standards are evidence-based, and they're made by the experts in that field. There's data use, that there's kind of constant improvement, that figuring out, all right, we're doing well here, we're not doing as well here, we can improve here, and undertaking improvement to continually get better. And then there's the verification piece that, we think we're good, but is a third party coming in to tell us that we are good to verify that these things are in place. And what that gives is patients assurance that it's not just our hospital saying we are good, but it's another set of eyes saying that, yeah, you meet these standards and you are using this data. So those are the three things that are these programs made of, and we know it works. Our trauma programs have, if you go to a trauma center, there's a 20% less lower mortality rate. If you go to a bariatric center, that there's more weight loss, there's better resolution of the comorbidities such as diabetes and arthritis and so forth. If you go to a breast center, we know that 20 to 50% improved compliance with the chemotherapy when it's appropriate, or the radiation after a lumpectomy, and all those types of things. And so we know that when these standards are met and when the data are used, that the care is better. So this is what we're now sharing with the policymakers, that, all right, we've tried these single onesie, twosie metrics of SSI and VTE and UTI. Not that they're not important, but really we have to think much more holistic, and how do we have a program? How do we look at these things all together? So we've developed this surgical quality partner plaque, and it's a diamond, and the diamond signifies just excellence. And the hospitals, you all, having this diamond, we want to recognize your excellence and partnering together to really optimize how we care for patients. So to be awarded this plaque, we know that you've gone through rigorous verification, meeting these standards, using the data, and it's really putting all these things together to get all this care for our patients. So what I'd like to do is invite the hospitals up one by one. I'll call out the hospital, and please come in. Whoever's part of that hospital, please come by, pick up the plaque, and have a picture with Dr. Turner, and then come up here on stage, and then exit this way. And then we really want to recognize all of you who are doing this great work and partner together to give the best care that we can for our patients. So I'm going to start off. And this is alphabetical, and we're going to start off with Berkshire Medical Center. So the folks of Berkshire Medical Center, please come up and receive your plaque, and we'll have a picture. So go over there. Great. The next partner is the Beth Israel Deaconess Medical Center. Is anyone here from BI Deaconess? No. Maybe they're on their way. The next is Boston Children's. Oh, okay. Dr. White. Great. The next is Boston Children's Hospital. Boston Medical Center. Next is the Brigham and Women's Faulkner Hospital. Great. Next is the Brigham and Women's Hospital. Hey, Ron, how are you? Hey, good. Cambridge Health Alliance. Oh, and this is also Everett Hospital. Terrific. Cape Cod Hospital. The VA Boston Healthcare. Great. Leahy Hospital and Medical Center. Massachusetts General Hospital. No, no, no. Everyone follows directions and comes off this way, except Dr. Hunter. Melrose Wakefield Healthcare. Congratulations. Newton Wellesley Hospital. Congratulations. Salem Hospital. UMass Memorial Medical Center. Winchester Hospital. Congratulations. So please give everyone a round of applause. This is really terrific.
So that was wonderful, and I really look forward to visiting your hospitals and seeing these diamonds prominently displayed. And I think importantly, the patients will enjoy seeing these diamonds prominently displayed. One of the things that we know is that patients trust the ACS to tell them where's the right place to go for high-quality surgical care. So in a recent survey that was done for patients who were expecting surgery for themselves or a family member, 55% of those patients identified the American College of Surgeons as the entity they would trust to direct them to the right hospital for care for themselves or for their families. And that's meaningful, and part of the reason why the ad, which of course is in front of you, really highlighting all of you as our surgical quality partners, is meaningful for those who are making healthcare decisions for themselves and for their families. So again, I'm privileged to celebrate all of you and celebrate with all of you, and really would want to hear from you, what can we do to make this effort even more frictionless for you? How do we partner with you more effectively? What are the things that we need to know, things that we're doing well, things that are opportunities for us to enhance our interactions with you? Because at the end of the day, it's only through this sort of robust partnership that our patients can continue to benefit from what is our 110-year-old motto, to heal all with skill and trust. So thank you so much for being here. Really a pleasure, and I hope to spend some time speaking with all of you, as will Dr. Coe and others of our leadership team. I'm here in the back. I'll just name the fact that we've got our president, immediate past president, Dr. Chris Ellison here. We have many of our Board of Regents here. We have leadership of the Board of Governors. We've got incredible staff in our DC office, in our quality improvement area, in our communications team. So this is an entire effort of the American College of Surgeons, and we're so pleased you're here and you can interact with our leaders. So thank you so much for being here.